Okay, we're so excited. We already started the segment without you guys. Sorry. The FDA approves a new eye drop, an eye drop that can help improve your vision.
Dr. Sandy T. Feldman of Clearview Eye and Laser Center joining us now to break it all. So
this is wild.
Does that mean that he can take, and we can take these with a drop?
With the drop, you can actually improve your reading vision, okay? If you wear distance glasses, you may still need those. So it's what happens when we get in our 40s, and all of a sudden, our arms aren't long enough, as you've been telling me.
To do the thing, yes. So
okay.
it substitutes for reading glasses, because when I heard about this story last week, I said, we got to get Dr. Sandy on the phone. We got to get her in here. It's like reading glasses are gone because you now have a drop.
Correct. It can give you functional near vision for up to about 10 hours. In about 70% of people, it lasts 10 hours. So that means you can get through your day, without your reading glasses. Now, if you work and then you want to go out to a restaurant, you may need to time it. Or it can be variable. So in some people, it could last possibly longer than 10 hours, and in some people, shorter than 10 hours. When you put in the drop, it takes about 30 minutes to get an effect from the drop. But again, it lasts in 70% of people 10 hours.
These are called, is it Vizz? Is that
Vizz.
Vizz eye drops. Okay, so I'm just trying to envision this. You would put an eye drop, like let's say in the morning, it'll last you through the day. Who is this perfect for?
It's perfect for people who need reading glasses, usually between the age of 40 and 55. Above that, you know, unlike fine wine, things continue to change, you know? And we may need other treatments. So it's a great bridge to other treatments that are available for our vision.
I want to ask you so many questions, but when you mention they last 10 hours, but if you get off work and it starts to wear off, but you want to do other stuff like go to restaurants, if you apply it again, but then you go to sleep after 3 or 4 hours, is that okay? Or is
we really don't know. It hasn't been used that way in the FDA clinical trial. However, people will likely, you know, do things like that, or you time it. You say, okay, instead of putting it in first thing in the morning, I'll wait till after breakfast or when I get to work.
Yeah, but if they're for reading and you're like gonna go out and whatnot, like is it just for when you're working and you're reading like books or?
Right, well it gives you the reading vision, so it takes you back and you kind of lose a few years when you can see distance as well as see close up.
Are there side effects to this?
Well, anytime we use any kind of medicine, there can be side effects. Good news is the side effects were transient and they weren't severe in the studies. Your vision, it may burn a little when you put in the eye drop. Your vision can get dim or you can get headaches, but again, they were transient.
Okay. I know that Shelly asked who's a good candidate for this, but I want to ask more specifically, if you've had LASIK, can you still use these drops? If you haven't had LASIK, you wear glasses, just who can actually, who's a good candidate for, if I've had LASIK, I can still use it?
You can still use it if you had LASIK, because it's basically just an eye drop. And the purpose of the eye drop is it's working selectively on your pupil to make it smaller, so you get a pinhole effect. Less peripheral light rays enter the eye, so they make your functional near vision better, but it doesn't really affect your distance vision or change your prescription. And that really is a differentiating factor for this drop versus others on the market.
I mean, that's incredible. All the years that you've been doing this, is this pretty like a miraculous drop, isn't it?
Exactly. This is another addition to kind of the lifestyle procedures that we have to really enhance the quality of your life.
Okay, this comes out, you said October-ish. So now here's the important question. How much is it? Is insurance gonna cover it? How would people get their hands on it?
Okay, so you're gonna need to have an eye exam. So we make sure that you don't have anything that would predispose you to serious side effects. So first, you'll get an eye exam. Insurance will not cover it. It's considered a lifestyle drug. It's not something you have to have.
Yes, you do.
Okay. And the cost will be under $79 a month. If you buy a 3-month supply, it'll be about $198.
Some people would argue that this is not a lifestyle thing, that
Yeah.
this would really enhance their work and their just daily life. And is there how does that work to maybe get insurance companies to cover something like this?
Well, I'm not an insurance expert, so I don't really know. But there are alternative treatments such as glasses.
Yes.
And because of that,
I see. That's
they
what-
don't have to cover
Boy.
the eye drop.
A little
Okay, make a note. Vizz coming
Vizz.
soon.
Listen, I mean,
October.
that's
I'm
a
making a play.
game changer right
over
there, I
this.
think, you know? I mean, it really is. Look at this.
Well, we can take a few years off.
Yes.
Why not?
Take them all off.
Take 'em all off.
Well, no, not like.
Raul.
Dr. Sandy, is always a pleasure with Clearview
Thank
Eye and Laser
you.
Center. We appreciate your time and expertise as always. Do I look weird without my glasses?
You look different.
I look different. I got much shorter hair, no
You have-
glasses on.
Yeah, yeah. And gray, very
Oh,
white,
oh.
salt and peppery, right?
See this, Dr. Sandy?
I mean,
All right.
that I
should
can
roll.
see
Well
with
done.
or without glasses.
It's
Thank
time for weather. I know that. Thank you again.
Let's go. I'm making
Thank
an
you,
appointment,
guys.
Chrissy. Let's
yes,
go.
yes.